Okay, the next manual muscle test that I'll be talking about with you guys today is the latissimus dorsi manual muscle assessment. So with this one, we are assessing shoulder extension, adduction, and internal rotation. The primary muscle that we'll be assessing, of course, the latissimus dorsi, but some other muscles, including the posterior deltoid, the teres major, triceps, and rhomboids in lower and middle traps. So we're going to have our person laying on their stomach, so prone. We're going to place one hand on the opposite shoulder that we'll not be assessing. Then we're going to fix their shoulder that we're assessing, making sure that the elbow is fully extended and the palm is flat. We're going to ask them, we're going to kind of passively place them in extension, adduction, and internal rotation of the shoulder. So kind of up behind them just a little bit like that. And then we're going to take our other hand that's not resting on their opposite shoulder and place it in the middle forearm right here. And then we're going to gradually pressure into the flexion position. So we would be actually pushing down here on the lateral side of their forearm, pressing in the direction of flexion and adduction. If they show any signs of compensation, it would be trunk extension, movement in the opposite shoulder, and scapular adduction. So we want to look for signs of that. If we see it, we're going to grade them a 2. If they are unable to kind of resist your force and they do move towards flexion, then we're going to grade them a 1 and consider that muscle weakness. And if we don't see any signs of either one of those two, then we're going to grade them a 3 on the manual muscle assessment. If there are signs of compensation or muscle weakness, some underactive muscles to consider are the anterior deltoid, the upper traps, the pectoralis major, the biceps, and the infraspinatus.